Hello, everyone. My name is Nishtha Sareen. I'm an interventional cardiologist, and I welcome you to our podcast series, Heart2Heart, brought to you by BIA for You for Them. It's 5 to 10 minutes every month, and we hear from our physician leaders from the community talking to us about any condition that you need to know. This month, we are going to be talking about peripheral arterial disease with Dr. Patrick Alexander. Dr. Patrick Alexander is an interventional cardiologist at Ascension Providence Hospital. He's the Associate Program Director for Ascension Providence Cardiovascular Fellowship, Clinical Associate Professor from Michigan State University. He specializes in treating peripheral arterial disease and does a lot of fantastic work in the cath lab. So it's such an honor and privilege to have you here, Dr. Patrick Alexander. He has also authored a chapter in the book, Bia, She is the Force. Peripheral arterial disease is blockages in the arteries of the leg or in the upper extremity that decrease blood flow and can lead to lifestyle compromise, pain, ulcer, and even amputation. So it's really important, and we are truly grateful for you, Dr. Alexander. Please tell us a little bit about peripheral arterial disease and what you think is a good age to start screening.
Thank you for that kind introduction, Dr. Sareen. Thank you. As you mentioned, peripheral arterial disease is a blockage or narrowing in the arteries outside of the heart. So it can involve your arteries to your brain, your carotid arteries. It can involve the arteries that supply your gut. It can supply the arteries, involve the arteries that supply your legs, which I think we see more commonly. As far as screening is concerned, traditionally the age of screening for patients for peripheral arterial disease is around 65 years of age. However, with additional risk factors, screening can occur much earlier. For example, if you have diabetes, if you have hypertension or have high cholesterol, if you are a smoker, screening can happen as early as age 50. And so there really is no absolute time. It can depend on the individual person and their risk factors.
Thank you, Dr. Alexander. What about some risk factors that they should look for in addition to diabetes and hypertension? Is there anything else they should be looking for?
Well, the most important risk factor for peripheral vascular disease or peripheral arterial disease, outside of what we just mentioned, is tobacco use or smoking. And so if you're someone who has smoked or is currently smoking, your risk of having vascular disease is 10 times higher than your counterpart who is not smoking. So that is the number one risk factor. Other risk factors that we don't hear about too much is being menopausal, lack of protective hormones, especially in women, kidney disease or dialysis. Those are very strong risk factors for developing peripheral vascular disease.
Thank you, Dr. Alexander. And what symptoms should we be looking for?
The classic symptom for someone with peripheral arterial disease, and I apologize, I'm using peripheral vascular disease interchangeably, but vascular disease in general is muscle fatigue when walking, or what we call claudication. And more commonly, it happens in the calf muscles, but it can happen in the thigh, it can happen in the buttocks area. So if you're walking, you find that your muscles are fatiguing very quickly to a point where you have to stop. And when you rest, you recover. But then when you walk again, there's a recurrence of symptoms. That is a very strong indication of having peripheral arterial disease or insufficient blood flow to your extremities.
Absolutely. And just to add, that's a great point, Dr. Alexander. To add to it also, as Dr. Alexander alluded to, blood flow is the critical part of it. So if you have non-healing ulcers also, and you have a blockage in the artery, it can impede the ability for that ulcer to heal. Dr. Alexander, what are your top 3 things you want our listeners to know or to look out for peripheral arterial disease?
So peripheral arterial disease, it can be challenging. I use the analogy, it's like finding a needle in the haystack. So you really have to investigate. My advice to patients out there is know yourself, number one, know how you feel, how your body feels. And if something's unusual, always bring it up to your physician. Look for the signs that we know about, muscle fatigue or claudication. But keep in mind, majority of patients with peripheral arterial disease do not have classic claudication or classic muscle fatigue. In fact, only about 1 in 5 women with peripheral arterial disease presents with classic symptoms. So it's very important to monitor your extremities, to look at your feet, to look for discoloration, to look for maybe lack of hair growth where there was hair before, to check the bottom of your feet or in between the toes, especially if you're diabetic, and look for ulcers. They can be so small you may not even feel them, you may not even see them. So it's very important to do regular surveillance of your extremities and potentially detect something that's early in the stage.
Those are some outstanding pieces of advice, Dr. Alexander. Thank you. To learn more about peripheral arterial disease and to read Dr. Alexander's work, you can look at Bia. She is the Force. Dr. Alexander has contributed a chapter in that book on peripheral arterial disease. Again, if you have any topics that you'd like to suggest for the podcast, please request the topics at biayourselfcontact@gmail.com. Once a month, we talk about heart conditions. Next is going to be next month. Until then, have a great day and the rest of the month. Thank you, Dr. Alexander. It was a pleasure having you today.
Thank you. Thank you, Dr. Sareen. My pleasure.